Good afternoon. I'm Dr. Joss Reimer, the medical lead for the Vaccine Implementation Task Force. People who have received a first dose of any vaccine, AstraZeneca, Pfizer, or Moderna, can now make second dose appointments if they are eligible. As of today, people who had their first shot on or before April 20th are now eligible to make an appointment. À compter d'aujourd'hui, les personnes qui ont leur première injection le 20 avril ou avant cette date peuvent prendre rendez-vous pour leur deuxième dose. In addition, all Indigenous people in Manitoba, as well as individuals with the listed health conditions, continue to be eligible to make a first or second dose appointment. For Pfizer, you must have had your first dose at least 21 days ago. For AstraZeneca and Moderna, you must have had your first dose at least 28 days ago. For AstraZeneca, we also recommend for most people to wait 8 weeks between doses, if possible. People who have had a first dose of AstraZeneca have had many questions as we've started to open up second dose appointments for people. And while I spoke to this on Monday, there are some key points that are worth repeating. The recently released Combavax study from Spain shows that people who had a second dose of an mRNA vaccine after AstraZeneca had a strong immune response. They measured 3 different markers of antibody response, and all 3 of them showed very large increases between 37 and 80-fold above the level that they were at after the first dose. The most important factor that led to our decision to allow interchangeability with the second dose being mRNA was not actually these new studies, but rather the many decades of research and experience that we have in vaccines. We've seen good results when we exchange products for other diseases. We see that when we exchange products, we get good effectiveness. And because of this, there are many existing examples in our current vaccine programs where we use different brands and sometimes even different vaccine types interchangeably. These studies were helpful because they provided confirmation that the COVID vaccines create the same immune response that we expected. So that means that your second dose can be an mRNA vaccine, either Pfizer or Moderna. There are still a small number of AstraZeneca doses, about 2,000 of them, within medical clinics and pharmacies throughout the province. And these doses are for people who are unable, for any reason, to get an mRNA second dose. To be very clear, it is far safer to receive a second dose of AstraZeneca than to not receive a second dose at all. And I also want to be clear for those who received the first dose, and I know I've said this several times, that you did the right thing. You protected yourself and you protected others by getting the vaccine when it was available. You prevented people from ending up in the hospital and you prevented deaths. This is particularly important in light of the new guidance from the National Advisory Committee on Immunization. The new NACI guidance allows more flexibility in 2 different ways. The first is what I've just been discussing, where NACI has indicated that mRNA can be used as a second dose after AstraZeneca. But the second aspect that NACI highlighted is more flexibility in changing up second doses between the mRNA vaccines, both Pfizer and Moderna. This will allow us to offer second doses of Pfizer to people who have received Moderna, and second doses of Moderna to people who have received a dose of Pfizer if required because of vaccine supply or any other issue. I also want to highlight that NACI indicated that our international partners will be recognizing people who receive a mixed schedule as fully immunized. So far, we have only rarely had to offer the mixing of mRNA products in Manitoba. However, we are planning for this as an approved option whenever needed so that Manitobans can be sure that there will be no delays of their second dose. So Manitobans can expect that in order to ensure this delay does not happen with their second dose, that at times the alternate mRNA may be offered. Until now, our teams have been focused on the speed of delivering vaccine as supply increased. While most people visited a super site for their vaccine, we also reached out to those who couldn't get to a super site. That included outreach to congregate living facilities, personal care homes, some of our pop-up clinics, as well as providing vaccine to medical clinics and pharmacies. But while the second doses have now started, we need to continue to increase the number and the percentage of the population who received a first dose. Même si l'administration des deuxièmes doses a commencé, nous devons continuer d'augmenter le nombre de personnes et les pourcentages de la population ayant reçu une première dose. However, first doses remain critical to reopening plans in Manitoba. So now is the time for us to take more steps to make it even easier for people to get their first dose. We recently conducted a small pilot project to offer mRNA vaccines with several medical clinics and pharmacies. This project went very well, and so this week we're delivering another 5,000 doses of mRNA vaccines, Pfizer or Moderna, to about 25 clinics and pharmacies. These can be used for first or for second doses. Also in June, we'll be working with all of our participating pharmacists and doctors at more than 500 sites to provide a weekly allocation of these vaccines on a go-forward basis. However, the exact location and amounts may vary, and we're starting with smaller numbers but expect to increase them over time. People can visit our vaccine finder website at protectmb.ca to find out where they can make these appointments. We expect that this will help improve access for communities who are facing barriers by having vaccines provided in known and trusted locations with known and trusted healthcare providers. We are also planning to have some healthcare and correctional sites manage their own immunizations. So this includes enabling hospitals, personal care homes, correctional facilities, and healthcare facility occupational safety and health teams to be able to administer their own immunizations. This mirrors other immunization campaigns, such as the seasonal influenza campaign. More details will be shared with the sites in the coming days, but they will be able to order and administer vaccine based on their needs. This will allow them to immunize new admissions more quickly, as well as specific staff members in some cases, to ensure that there is good protection available in those facilities. In addition, we are also expanding a third mechanism to improve vaccine access in response to data showing that not everyone is affected by COVID-19, nor has access to the vaccine in the same way. Some communities have been affected more significantly. This includes Black, Indigenous people, and people of color in Manitoba. While super sites continue to be where most people are getting their vaccine, we now need to increase our focus on equitable access to the vaccine. So we are working with several community organizations to start a mobile outreach option for vulnerable populations, including people who are unsheltered or street involved. These community partners have the expertise and the trust needed to make this approach successful. And this outreach is beginning today. In addition, a number of organizations and businesses have reached out to us about having a clinic at their site or their organization. We've already seen great success with clinics run at a small number of these sites. And so the opportunity for community-hosted clinics will continue to expand over the upcoming weeks. And we will share more details as we can. We're also moving forward with having focused immunization teams or home care teams visit people who are unable to leave their homes. And we will continue to schedule more pop-up clinics to ensure that people who need the vaccine can access it closer to home without having to travel to a regional super site. To those who have, who still have to make their first dose appointment, it is not too late. I encourage as well everyone who's eligible for a second dose to book as soon as you're eligible. The success of this vaccine campaign hinges on all of us. And while we have the privilege of sitting at these press conferences and to be able to talk about this campaign, there are so many leaders all around us who are playing a critical role in this vaccine rollout. So before I wrap up, I just wanted to share a few stories that I've heard this week that show some of the community leadership that continues to be integral to the success of the vaccine rollout. So we had one Manitoban who recently challenged gender stereotypes and raised thousands of dollars for the Rainbow Resource Centre and helped to promote and encourage vaccination by coming to his vaccine appointment in a wedding dress. We also had a local teacher and artist from Steinbach who is creating a lot of positive buzz by his Menno and vaccinated shirts, as well as buttons that can be ordered. And they're creating a sense of community connection to vaccination amongst Mennonite Manitobans. And I really want to thank these leaders, as well as encourage everyone else to think about how they can support the people they know and support their communities. And with that, I will turn it over to Johanu.
Thank you so much, Dr. Reimer, and good afternoon, everyone. I'm Johanu Botha, Operations Planning and Logistics Lead for the Vaccine Implementation Task Force. As of today, more than 66% of all adults in our province have now received at least one dose of the vaccine. Each dose administered is helping to protect us and our loved ones and supporting our return to the activities that we all love. This week, we'll give more than 81,000 doses in our super sites, pop-up clinics, urban Indigenous clinics, and through our focused immunization teams. And we will completely exhaust the vaccine supply that we have on hand in a week and a half. Next week, we expect to give about 86,000 doses through those same channels. And again, the number of doses we're providing every week shifts based on the number of doses that we receive from the federal government. While our vaccinated numbers continue to increase, we're aware that some Manitobans have received their first or even their second vaccine outside of Manitoba or Canada. Now that they're home, we need to tie their records into our data systems. If you got a dose of vaccine outside Manitoba or outside Canada, we need you to get proof of immunization from the jurisdiction where you got your vaccine. If the vaccine is eligible for use in Canada, you can bring this proof of immunization to a local public health office. They will enter this information into our public health information management system and will ensure that your primary care physicians and our public health teams have access to your information through patient immunization records. This will help make sure you get the right doses of vaccine at the right time. It will also help us know the true number of Manitobans who have received the vaccine. At this time, of course, the vaccines approved for use in Canada are Pfizer, Moderna, AstraZeneca, and Janssen, made by Johnson & Johnson. If you received a vaccine not approved for use in Canada, we're working on options on how to include your vaccination in our records. As Dr. Reimer noted, significant work is underway to reach out to those who may not have easy access to the vaccine. This has involved a lot of outreach to community partners and a great deal of planning and logistics to make sure we can use these channels safely to make immunization more accessible for more Manitobans, particularly for those who haven't had a first dose yet. I want to thank those who are working together to make these projects work as smoothly as possible to ensure we can reach those at risk. These people, as Dr. Reimer had mentioned, and teams include our pharmacists and physician partners, hospitals, personal care homes, corrections, RHAs, regional health authorities, of course, through pop-ups, and our many community partners. They're all helping us improve access to the vaccine by making sure people can go to a trusted provider or site to receive a dose. Before I turn over to questions, I want to talk about the emergency evacuation at the RBC Convention Center vaccine super site on Monday. I want to thank everyone who responded so quickly to get us back up and running. Our emergency plans were followed and they worked. It's a complex facility on any day, especially on a day when thousands of people are getting a needle in an arm. Our patients and staff were safe, clients were safe, and we wasted no doses due to the evacuation. I also want to thank those whose appointments were affected by this evacuation for their patience. We did open up appointments this week to ensure those affected could have the opportunity to rebook as soon as possible. While regular announcements will be made about available appointments, as always, and our plans for second doses, people are encouraged to visit protectmb.ca often or follow @mbgov on Twitter for the most up-to-date information. More vaccine is arriving in Manitoba regularly, and we will continue to rapidly administer these first and second doses to people across the province. And with that, we can go over to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from Global News, Will.
Hi, good afternoon to you both. Dr. Reimer, I'd like to ask about the community-hosted clinics you mentioned a moment ago, and I appreciate you say more details are going to be coming, but can you just give people a sense of some of the criteria? How are they going to apply, for instance? What might be the requirements?
So this really comes out of the consultation that we're doing with a variety of communities where we've seen uptake is lower than the average for Manitoba. And so we're taking the direction from the community leaders as far as where are the best locations for these sites. And really it's, we're following their direction as well as far as how to communicate with Manitobans about these sites. So this is something that's going to continue to grow and change and develop throughout Manitoba. At a variety of different locations, and we will continue to do the outreach to meet with these community leaders. But I don't know if Johanu has any other details about the rollout there.
Yeah, I think the planning and logistics wise, we're taking a lot of lessons learned from our urban Indigenous clinics and of course our First Nation partners in their rollout. And the key lessons there, amongst many, are that the community itself needs to lead in terms of engaging community members, but also in the communication piece. So in many instances, it won't be our clinic to announce. We support the community. But of course, if the community wants support from us to announce, we will be happy to do that. And generally, what they will look like is they'll operate really based on sort of the community input and through as much community resources as possible. And then we'll use our resources to envelop whatever they put together through a focused up to and including a focused immunization team.
Okay, excellent. Thank you very much for that. In the earlier briefing, we heard the second dose rollouts may happen a bit slower due to the new delivery methods announced today. Can you just talk about how measurable that might be, and how are you balancing the need to get first doses out at the cost of maybe a bit of a delay for the second?
Sure. So, the direction from the clinical side is, but both these campaigns matter. We can't just stop one entirely and run the other one. At this time, the clinical direction is to us on the operations side, keep the second doses going, but first doses are incredibly important above just that 70% figure. So we're balancing that approach by getting the second dose individuals through our fast super sites. Most of them went through our super sites. And we anticipate, and we are seeing them sort of book enthusiastically to continue to do so. But we want to augment that velocity with some of the accessibility approaches that we outlined here today. And as much as possible, we want to avoid a trade-off between going fast and the accessibility approaches, which by definition are smaller in nature and they're smaller pipes. But the nature of our supply will have to dictate that. So if the Moderna shipments continue to be as volatile as they've been up to now. We may be in a scenario where we take we slow down a second dose cohort release a little bit to ensure that the first dose individuals who haven't yet had a dose have the opportunity through one of our accessibility delivery models to get that first dose. And in those cases, there may be an impact on the timeline. Hopefully not a major impact. There's all sorts of ways in which we're mitigating impacts to speed. Our pharmacists and physician partners have demonstrated through our pilot project that they can get the mRNA doses out within a week. And they are often situated in communities and areas that does have lower uptake. So they're good examples of how they might still move vaccine relatively fast while getting some first dose Manitobans still in. So we're doing a number of things to balance those out, but going in eyes wide open, we are not awash in supply yet, so there might be a trade-off ultimately between velocity in this, but we'll try and minimize it. And at this point, our timelines still show that we'll be able to get to 70% second dose Manitobans by the end of July while we're running through this accessibility delivery models. That's still currently our timeline.
Thank you.
From CJOB, Skylar.
Hi, good afternoon to both of you. Thanks for your time. Dr. Reimer, my first question is about, a small subset of Manitobans, but a decent portion nonetheless, that have received both doses of the AstraZeneca vaccine already. There are some, concerns and some ongoing research that shot may not be as effective against some variants, namely the South African one. Will there be a booster campaign or something like that in the future with a third dose of Pfizer or Moderna for those folks to make sure they are protected against those variants?
Yeah, the data on the South African variant specifically came from South Africa, where they halted their AstraZeneca administration very early on. So the data is very limited as far as the effectiveness because there was no further analysis available after the initial small rollout. But this is something that we're monitoring in Canada, in the US, worldwide. And recognize that we may need to offer third doses to everyone, perhaps only to people who receive certain products. It's really dependent on what happens with the variants. So we are, to an extent, at the mercy of the virus and whether it mutates in a way that our immune system, after being immunized, still recognizes, or if it mutates in a way that looks different to our immune system. And perhaps everyone will experience the same level of recognition, or perhaps different products will demonstrate that the immune system has different levels of recognition of different variants. So we're still very early in the process of analyzing the different variants, and they're going to continue to change. We expect that we'll see ongoing new variants for quite some time, and so we need to be ready to offer third doses to whatever groups of Manitobans may need it as this data comes in. But certainly right now, our focus is primarily still on dose 1 because we want to be having as many Manitobans with a high level of protection as possible. And then our second goal being dose 2 to get that protection level just that little bit higher, and that protection lasts longer, so that as we go into the fall, we know that people are protected going forward.
Thank you for that. Mr. Botha, I believe this one's probably for you. There are some people that may have made a trek to a super site or one of the initially available channels in the beginning and got that first shot, but it might have been, quite an inconvenience for them. Now that there are so many more options available, will folks like that be able to go to, say the pharmacy next door if they have an mRNA shot and get dose 2? They don't have to go back to that initial site?
Absolutely. So we will not dictate where Manitobans have to get their second dose in terms of the delivery model.
From the Winnipeg Sun, Scott.
Good afternoon to both of you. Dr. Reimer, Johanu mentioned this morning that the province won't accept future shipments of AstraZeneca and obviously the Johnson & Johnson, which we haven't received yet. Can you just go over the clinical side of that? Why is that happening? Just so the public can know.
So the main reason that we have recommended using mRNA for dose 2, regardless of what someone received for dose 1, comes from decades of research and experience with vaccines. We, in many of our vaccine programs, already use a variety of products for different doses in a series. And so the new studies, there was the CombiVac study from Spain, as well as the ComCoV study in the UK, and a small study out of Germany as well. They all showed us that so far the COVID vaccines appear to be consistent with what we anticipated. And so they were reassuring that these vaccines didn't present a new challenge that would force us to be different. But we were quite conservative at first because we wanted to be sure. We're in the middle of a global pandemic, and so we wanted more evidence and data to ensure that this was the right call here before assuming that these vaccines would be the same as our experience with other vaccines. And so when it comes to AstraZeneca, it is a safe and effective vaccine. We are thankful that we had it available, and we are thankful that Manitobans chose to get immunized with it. There's no question that it contributed to a lower number of cases, of hospitalizations, of deaths. And so, if we didn't have a strong supply of mRNA, we would be continuing to use it because we know that AstraZeneca, despite having the low risk of the blood clots with low platelets, is still much lower risk than the risk related to COVID. So while we're not accepting the shipment that's with the federal government right now, we do also know that some Manitobans may not feel comfortable and may refuse to receive an mRNA vaccine after AstraZeneca. And so while there's no current plan to receive more AstraZeneca here, we are in conversations with the federal government every day. And so this is something that we can continue to connect with them on. And if we see a trend in Manitoba where there's a large number of people who are not receiving that second dose, that this is something that we can look at again and reevaluate what the best approach is for Manitobans.
All right, thanks for that. And I guess kind of building off that, you talked a little bit about, some people just can't receive it, the mRNA vaccines, whether it be allergy, whatever it might be. There's about 2,000 doses left, I think roughly closer to 1,900 doses left in the province. Is there enough to get that population of people who just simply can't get it for medical reasons?
We anticipate that the number of people with a true allergy to the mRNA vaccine in Manitoba is exceedingly small. So the number would be well below the number of doses of AstraZeneca that we have left. And really, allergy is the only clear contraindication or restriction, reason that you can't get an mRNA. There are other times where, because of a complex clinical assessment, somebody may choose not to proceed with mRNA, but that severe allergy to one of the ingredients in the vaccine really is the only absolute reason that somebody couldn't receive mRNA. So we do anticipate those numbers are very low, but we do also intend to continue to watch that and make sure that whatever we do, that people are getting both doses of vaccine. So we anticipate that the 2,000 will be enough to meet the needs of those who can't receive mRNA. But if we're wrong about that, that's when we need to take things back and talk amongst our clinical team and our logistics team and with the federal government to reassess any future plans with AstraZeneca.
Thank you.
From CBC Radio Canada, Laisa.
Yeah, my first question will be, when it comes to mobile outreach vans and community-hosted clinics, when are we expecting to have the first community-hosted clinic, and what like talking about the the location. Do we have any location, any health regions that are targeted so far?
Maybe I'll take the first stab at it, and then the clinical pieces to Dr. Reimer. So in terms of the mobile van, it's starting today. It's a pilot project. It'll be sort of urban areas of Winnipeg, and currently it's focused on underhoused individuals. It's a pilot project that will measure and see how it goes. Obviously, it's a van. We don't need to allocate a tremendous amount of vaccine to it, but we'll monitor and see how well it goes. And the pilot will also assess how visible this van needs to be. There's lots of lessons learned we've gotten from engaging with community partners in urban Winnipeg on advertising the nature of the van. So that's starting today, and we'll see how that goes, and hopefully we can expand on that piece. In terms of the community-hosted clinics or supported clinics, so we've had initiatives already that have used this model. We're formalizing it a bit more and looking to do it even more. I think our urban Indigenous clinics is a prime example of this, and the clinic that's run at Knox Church is a good example of this. But the point of these clinics are to serve a very specific community. So in many cases, it won't be in the interest of the community for us to announce large-scale location or times. It'll be up to the community partner itself to lead that. And so the extent of the communication on the nature of the clinic will be led by the community partner. So more on that to come, depending on how much our partners would like us to support advertising. I think the best metric to see how all these accessibility approaches are going is seeing how many more Manitobans get that first dose. That's probably the best thing to keep looking at. Dr. Reimer, I don't know if there's anything you'd like to add clinically to that.
Yeah, I think that our main goal remains to get as many Manitobans protected with that first dose as possible. There's lots of conversation around reopening, and that first dose is critical for plans for Manitoba to reopen because the vast majority of the protection comes from dose 1. Dose 2 is still important. It does boost some people who didn't respond to dose 1 and get them immune as well. And even more than that, it prolongs protection. But particularly in communities where there isn't a lot of uptake yet, these dose 1 approaches are incredibly important so that we don't have pools of people where the virus can continue to transmit. So even if our overall provincial average is very good, if there's concentrated areas where people are not protected, the virus will have the opportunity to continue spreading there and staying in Manitoba, hurting not only the members of those communities, but also being a risk for all of us because we know that the vaccines are not 100% effective. So, these community clinics, the mobile approach, while we're not regularly announcing the list, they will be an important part of the ongoing efforts and a growing part of our ongoing efforts on top of what we've already done.
My second question will be, you also mentioned the fact that Manitobans that receive their first dose of vaccine out of the province or out of the country can have their second dose. Can you just elaborate more about what are the documents that they need to have that second dose?
So it'll depend on the jurisdiction where they received that first or that second dose. The jurisdiction ideally provides some kind of proof of immunization, and the process at the moment, because it needs to be validated somehow by our own public health folks, is that immunization record that comes from the jurisdiction where an individual received the first or second dose needs to be brought to the local public health office, and then they will review and enter it into our data. So it comes from the jurisdiction where it occurred. Yeah.
From CBC Manitoba, Bart.
Hi, Dr. Reimer. You're just looking at the dashboard today. Arm of Stanley, 18 and up, one dose rate still at 13%. Altona, 37. Hanover, 30. How is it going working with community leaders down in those southern health districts to improve vax uptake?
We have had some really encouraging meetings with a large number of community leaders who want the best for their communities and want to work with us to figure out how best they can reach out to their communities and be that support and that example. But this is going to be a long haul. We're not expecting that, after a few presentations or connections that we're going to see a sudden tip and a huge increase in uptake in those areas. This is about relationship building. This is about trust. This is about people feeling that their questions are being answered. So I would say that so far it's been very encouraging, the conversations that we've had. We're trying to do a number of different outreach mechanisms. I know, as an example, I saw that the Mayor of Winkler, along with Dr. Don Clausen, have been doing some outreach as well. Dr. Clausen being in Winkler for, I think, 40 years at this point, practicing and is well respected in that community. And examples like that, Dr. Clausen is going to have more of an impact on the community than the government could ever hope to have because he is that known and trusted voice. So we're absolutely encouraged, but we also know this is going to take a lot of effort and a long time. So the numbers are not going to jump up nearly as fast as we would like them to.
I want to ask you more specifically about Stanley because that is the absolute outlier in the province at 13%. It's almost half of Winkler in terms of its percentage. What in particular can be done for that particular region, which doesn't have the kind of concentration of people that even Morden and Winkler have?
Yeah, Stanley is the area all around Morden and Winkler. So most of the people in Stanley are quite linked into those two communities as well. But we, much like any other community, we want to work with their local leaders. So there'll be many different churches in Stanley that are outside of the municipalities of Winkler and Morden, and working with the leadership of those churches can be incredibly helpful. There's also, government leadership within those communities that we can partner with and strategize about how best to provide information to those folks. We also know that in Stanley there can be some language barriers. There's a large proportion of people who speak Low German as a first language or who speak Spanish as a first or second language. And so providing some materials as well as trusted voices in those languages could be really helpful as well in increasing the confidence that people in that area feel in regards to this vaccine. So we're going to keep working on this for the foreseeable future. We don't have any intention of stopping to promote what's best for the residents of Stanley, but it really will take more of the leadership from Stanley to be able to reach most people who live in that area.
From the Canadian Press, Steve.
Oh, hi there. I was wondering about the rate. Mr. Botha, you mentioned this morning that we may not be plateauing, but the rate of growth in terms of people getting their first dose is leveling off. And do you have any numbers on that? I know you're still predicting 70% uptake of 12 plus by the end of the month, but is the uptick getting slower and slower right now?
I would still say it's leveling off at our super sites, and then hence why the importance of these accessibility approaches. It's not like we're not seeing any first dosers continuing to book at super sites and pop-ups across the province, but it is leveling off. I do have numbers for where we are now. So this morning, it'll be on the dashboard. For 12 plus, we're at 62.7% of the population. We know that we have just over 53,000 appointments between now and around June 9th, first dose appointments. for those 12 plus. So that's great. That's a lot of people that will still get their first dose, but that's about 4.5% of the 12 plus population. So it gets us to 67.23% around June 9th. So we've got a target left of around 32,000 to get through first dosers between June 9th and the end of the month. And it's really up. Of course, it's up to the individual Manitobans to make that appointment or get that vaccine. But a lot of it is up to us and our community partners through providing the kind of delivery models that make this choice more feasible or convenient or reasonable. Hence these four, I guess, four buckets of accessibility that we're emphasizing now. But those are the numbers that's what we need to get to or get through to ensure that we get 70% 12 plus Manitobans by the end of June, while we chug along with our second dose Manitobans.
And some of this, as Dr. Reimer said, is a long-term project. In the months ahead, do you expect that on top of the community outreach efforts, the mobile clinics and that sort of thing, that more people might come on board as they see more of their neighbors getting vaccinated? And do you think we can realistically aim for 80 or 85% by the end of the year?
So I'm going to go to Dr. Reimer in a second in terms of how different groups in different areas, different age groups might behave. But from the delivery model perspective, the operations perspective, everything is pointing to our conventional channels, if I can put it that way, our usual pop-ups and our super sites, to get us to 12 plus 70%, certainly. It looks like by the end of June, and then beyond that, these accessibility delivery models should keep sort of clicking that percentage up. In terms of how far these delivery models can go and how long it might take, all I know from our delivery operational engagement perspective is this is tougher work. That this is engagement with communities. It takes time by definition. But how Manitobans might react, that's sort of more epidemiology, clinical piece, Dr. Reimer.
Yeah, so when it comes to intentions to vaccinate, we've actually seen both in Manitoba and in Canada overall an increase in the number of people who intend to receive the vaccine. And a large part of that is the growing familiarity with this vaccine. When it was brand new, when people had never heard of mRNA technology, even though it's been around for 20 years, we certainly never talked about it publicly very much. It felt very foreign and scary to a lot of people. But as they've seen their friends and family members, their healthcare providers receive the vaccine with good results, there's a lot more people feeling more confident in the vaccine. And even when we're talking about some of the areas of the province that have the lowest uptake, so the Stanley, Winkler, Hanover, Steinbach areas, the vast majority of those folks are not anti-vaccine. The vast majority of people who have not yet been vaccinated are those who have questions about the vaccine. So they're not against it. They just don't feel the confidence yet in this vaccine. And I do anticipate that, even if we didn't do any outreach into these areas at all, that we would see a continuous trickle of people from those communities feeling more and more comfortable with the vaccine as they've seen how it's impacted the rest of Manitoba. And we want to boost that trickle to become a stream of people coming in, because the last thing we want is for there to be a pocket of people in southern Manitoba who are still susceptible and continue to see infections and continue to see their loved ones in the hospital. So we will work hard to support the community leaders as best we can. But we do anticipate that there will be a continuous uptake for quite some time in these communities.
From CTV Winnipeg, Michelle.
Hi, we spoke
a couple days ago about problems with cancellation emails that were sent out that weren't, it was a glitch or a human error. We've heard of further problems, somebody as early as yesterday getting an email saying that their appointment was canceled because they weren't eligible, and then they were told that it was an error. So is there further problems with that, or what's going on with that?
So I can't speak to that specific scenario. There was the human error you had mentioned over the weekend with incorrect cancellation emails going out. No appointment was actually canceled. We rectified that within a couple hours with an email noting the fact that no appointments were canceled, and we've put a process in place to vet that many emails going out with an extra human resource to avoid that happening again. We did have for a brief period of time yesterday, individuals had to wait a little bit longer than they needed to because we were providing extra information on eligibility that for some people for a brief period of time just kept them on that loop of receiving the information as opposed to moving along in the call center queue. That was rectified relatively quickly yesterday. In terms of incorrect cancellation emails beyond what happened over the weekend, of course, we'll take it back and we'll look at it. I don't have anything new on hand at the moment. We do have cases, and I'm not saying this is the case in this case at all. We do have cases where individuals are booking for second doses when they can't yet, and then they will receive a cancellation notice. So in those cases, we just remind Manitobans to review the most up-to-date eligibility criteria.
Okay, thank you. Dr. Reimer, I have to ask you about the healthcare workers that are vaccinated that are going to this Jets game tonight. Given our third wave situation, what message does this send to Manitobans? And were you consulted on this decision to allow fully vaccinated healthcare staff to go to the game?
So public health was absolutely involved in the decision, and a lot of careful planning has gone into making sure that the protections at the game don't put anyone at risk of having the virus spread in that setting. So they're keeping the numbers very low. People will be required to wear masks the entire time, and everyone in attendance will have received 2 doses of the vaccine, with the second dose being at least 14 days ago. So, I mean, the biggest message for Manitobans is that we want to thank the healthcare workers who have been doing this for a year and a half. And while we're telling most Manitobans to stay home, that's not the message we give to the healthcare workers. We're asking them to come in and to put themselves in front of this virus every single day. And so, this is a tiny token of gratitude compared to the monumental effort that healthcare workers have put in the last year and a half. But it was something that the government wanted to provide even that tiny token of gratitude, and that public health was engaged in to make sure it was done in a safe way.
From City News, Alex.
Good afternoon. Thank you both for the time again. I asked this question this morning at the technical briefing, but for those who are listening now, local leaders such as pastors and mayors are volunteering at super sites in the Southern Health region. So again, you could just speak on what exactly they're doing there. I know you mentioned they are encouraging everyone to get the vaccine, but do you think them being there will make a significant difference to get those who are hesitant to get the vaccine?
So the second part, I think I'll go to you, Dr. Reimer, but in terms of their role at the super sites, they fill the role of a volunteer, which has always been an aspect of our super sites. We've always had volunteers there. It's always been an important part of how we operate the super sites. Manitobans from all walks of life, I think, feel comfortable going into these large facilities and seeing recognizable faces. This has always been the case. And so what we're doing in Southern, based on some of the the lessons learned and information we're getting through the engagement process in Southern, is to emphasize this even more, is to use volunteers, local volunteers even more, especially religious leaders, but the general leaders from the community, political leaders, municipal government leaders, to do the role of a volunteer, which can range from greeting, helping people on where to go, telling what information they might need or already have, and if they're good to go. They really support the more formal navigator role on site. That's their function. And in terms of the potential impact on uptake,
yeah, and this is one of many things that we want to be doing to help engage the communities and make them feel confident in the rollout, whether it's at a super site or a local clinic or a pop-up or a community organization. So this is just one way for community leaders to reach out to their populations and to help them feel more comfortable in the site. So, coming in to a super site, if it's something that you're feeling anxious about, and seeing that trusted individual there makes people feel calm. My mom is a navigator at the Morden super site, and so she's told me lots of stories about people who come in feeling anxious, but then when they see someone that they know, when they see her and can have those conversations about what to expect, about what her experience was being vaccinated, that it's a palpable relief to have that person that you know and trust there to connect with. So this is not the solution to addressing uptake in the region, but it is one part.
Great, thank you for clarifying that. And for those folks already eligible for the second dose, do you guys know numbers in terms of how many of those who are eligible have already booked the second dose?
I don't actually have that on hand at the moment. So in terms of how many have booked, in terms in relation to who's eligible, and then the projected timeline, at the moment I don't have a fresh snapshot on hand. So we can look at getting that for you. What we do know is that our overall timeline, given projected supply, is that we'll still get through 70% of Manitobans 12 plus second dose by the end of July. That's the current timeline given supply. Yeah.
From CHVN, Taylor.
Hi, good afternoon. A lot of the areas that are facing slower vaccine uptake have a very strong farming community, and these agriculture workers don't have a whole lot of downtime. How is the province reaching out to them to give them vaccine information and help them book appointments?
Yeah, so the Southern Health Santé Sud has a long history of working with the community members in their region. And so there's many different mechanisms to reach out. But certainly the summer is not a great time for farmers to be able to leave during reasonable hours to be immunized. So, we recognize that some of them may delay their vaccine just because of where they are in seeding, and may delay to do it before harvest. And others will need to do some special outreach. Perhaps there's things that we can be doing in relationship to churches in the area that would give them the opportunity to receive the vaccine on a more flexible schedule. But lots of work from Southern Health is ongoing about how to reach the large variety of people that live in their region.
And today will be the first time Manitobans will have that ability to go to a Jets game in over a year. I know you can't speak to the health orders, but should fully vaccinated Manitobans expect to see more of these kinds of opportunities to pop up over the summer?
Yeah, and that's the whole plan of our vaccine campaign, is that we can start doing some of those activities that we used to do. So this is a very small example for a very limited number of people in Manitoba. But as our numbers go up, that's the intent, is that we start to be able to participate in activities again, that we can do it in a safer way once we're immunized. And so I know that the public health team with Dr. Rusin are working right now on developing the safest recommendations for what types of activities could be opened up as we go forward.
Our final reporter this afternoon from the Winnipeg Free Press, Danielle.
Good afternoon to you both. The Manitoba government said a vaccine incentive program would be announced last week, and we've yet to hear the details of that program. How important is it to get the incentive program running, and is this an urgent matter for the vaccine task force?
Yeah, so what we know about all of the research that's been done on vaccine hesitancy is that we need to be really cautious about incentives. It's very easy for people who are already struggling with trust with the government to see incentives as something that the government is using to push people to do something that they wouldn't otherwise want to do, and can actually promote mistrust if we do it without being really cautious. So part of the reason that no incentive program has been announced is we want to make sure that we do it in a way that truly does incentivize people without at the same time de-incentivizing many other people. So this is work that we have a team who is developing right now, and they're looking at a variety of different benefits and incentives to do on a slow rollout basis. But we've communicated with some of the researchers at the University of Manitoba who look at health communication and all the time and risk communication, and we're using their evidence to inform this and ensure that what we do supports confidence in the vaccine for all Manitobans.
Okay, thank you very much. And with respect to the strategy to increase vaccine accessibility, how do you see large workplaces such as food production or other job sites, maybe manufacturing or construction, factoring into the strategy? Will that be a priority for the deployment of pop-up clinics?
Yeah, those are great examples of what we hope to see. So we want to see things in community organizations that focus on specific communities, but we also know that for many people, the workplace is the ideal setting to receive a vaccine. Many of these individuals are not hesitant about the vaccine per se, and it's more of a convenience issue, a prioritization issue. And if we're able to set up a vaccine clinic in a place where they already will be, they would be happy to receive it. There already have been some of the food production companies that have partnered with some of the physicians and pharmacies in the distributed channel to run clinics on site, and we were really happy to see this work starting. We've also asked all of the regional health authorities to look at their food production facilities, to look at their work camps, to look at locations that house temporary foreign workers, and come up with the best strategy to facilitate vaccines for all of those locations. Some of the things that they've been doing, in addition to offering clinics on site, is offering group bookings at super sites. So that means that large numbers of employees get booked at the same time, and the company can help with transportation and bringing them all together so that they have the comfort of their coworkers there with them and the support of their employer. And that's been very successful with a number of businesses as well. So we expect that this will continue to grow as we go forward, and we encourage all of our partners to think of these excellent creative solutions that are extremely effective at increasing uptake.
Thanks, everyone. This concludes our media briefing.